Hi, Dr. Birkenmeyer here. Just want to give you a quick video. I haven't shot one of these in a couple of days, so thought I would just give you a quick 2-minute rundown here. Um, I had a woman come in today who she was 90 and she looked like she was in her mid 70s. Just looked as a fantastic looking lady and looked very young and vibrant. She was very much together. And she said something at the end of our conversation. I thought that was really, really interesting. She said, I came in here today skeptical. She said, in fact, very skeptical because I've been a lot of different places and people have told me all kinds of things that were really not true. And she went through and tried to get some help for one thing and couldn't get help. And it was this kind of this drill, this kind of pass around situation. She went to a place for a different health problem than what we see at the Neuropathy and Pain Relief Institute. But the doc tried to sell her on some humongous deal for her hearing when she didn't have a hearing problem. And that creates a whole level of skepticism where there's really seemingly nothing sacred anymore. I mean, healthcare should be helping people and helping improve their lives. That's what it's about. And those kind of stories just really make me sick. So what I actually told this lady was the way to help with skepticism. And I told her, I said, you see all these gray hairs on my head. I've been around the block. I'm approaching my 50th year. I'm not quite 50 yet, but, moving that direction. And yeah, I've been in situations where I've been told things are going to happen and they haven't happened. And I've been very disappointed. So I told her the way to allow that skepticism, which is very healthy to come in, a little skeptical. You ask questions and you ask about what the person has seen, what the person has heard, what their experience is. The way to help with the fear and the skepticism is by getting results. That's the way. You want the result that's there, that's supposed to be there. The best we can do in healthcare is look to see, does this case look like other cases that have gotten better in the past with care? That's really the best we can do. And so we evaluate somebody, we look at that question, and then we treat them for a reasonable period of time. Now, reasonable is not 5 years. Reasonable is also not 2 days. Usually about a month is a reasonable period of time. It's like anything. If you go to work out and you go work out and lift weights for 1 day, you've worked out for 1 day, but you're not going to be able to see the results. So what you have to do is you have to give it a reasonable period of time. So usually in health and healthcare, a month will show you what's going to happen. So evaluate, treat for a reasonable period of time, reevaluate, and reassess what progress is there. Progress is the way we anticipate, fantastic. Progress is slower than we anticipate. We have to start asking the questions about what else is going on for this person, what other conditions might be going on that they need to address. And we just watch. And if they're ahead of the curve, like I had a guy come in this morning, he's been here 4 or 5 days and he's already able to wiggle his toes, which is phenomenal. And he was even one of the harder cases that he actually had chemotherapy-induced neuropathy situation, and he was all excited. But basically, that's the strategy. Evaluate, treat for a period of time. It's reasonable. Reassess the situation, and based on that, you move forward, and you see what needs to happen from that situation. So, skepticism. It's really good to have it. And so that makes us and has us ask the right questions. Just had to share that with you. I see some really awesome people in the office. Would love to help you or a family member or a friend that you might know. Just give us a call, 314-485-2790. You'll see links on some of these posts. If you want to click on those links, there are some vouchers to get an evaluation so we can talk. Also, I have some really cool stuff coming out. I mentioned my book in another video. It's really exciting. The book, well, I don't want to ruin it, but the book is out. I'll shoot another video and share that with you, and I'm really excited. So we'll talk to you soon. Have a great evening.